BVI will soon be validated by the World Health Organization as one of the first countries in the Caribbean to eliminate mother-to-child transmission of HIV, right behind Cuba, who was the first Caribbean country to be validated. Noeline Levens-Clark, coordinator of the Family Health Unit, assures that the BVI is ready.
We are right behind Cuba. Cuba was the first Caribbean country to validate that they have eliminated mother-to-child transmission of HIV. Cuba submitted their request earlier this year. The Virgin Islands BVI was second, and so WHO plans to come into the BVI in October, assess our health services, and just ensure that we're offering every mother HIV testing in the first trimester and the second. Any mother who is positive, we put them on treatment right away. We're doing it already, so we just need them to come in and validate that we too have eliminated mother-to-child transmission. We've only had one baby born with HIV over the last 5 years, and we had that justified by research, and so we're ready to be validated.
Since the HIV epidemic started in 1985, the BVI has recorded 120 cases. Numbers show that in 2013 there were 10 cases, in 2014 there were 3 cases, and from January to June 2015 there were 3 more cases. Levens-Clark notes that although numbers are reducing, HIV is still around, with 5,700 persons contracting HIV daily. The Caribbean region remains one of the highest in the world, with approximately 250,000 HIV cases.
The numbers are decreasing, yes, but we are still exposed. Persons are still being exposed on a daily basis. So it should not give us a level of comfort. We should still step up our efforts, because we might get so comfortable that we end up being surprised in another year or two when our numbers skyrocket, and that's what we want to avoid. Knowing one's HIV status is the best prevention ever. If you test and you test negative, you can continue to keep it, so you can protect yourself from getting HIV. Remember I said earlier, 240 persons become infected with HIV every hour. That means that our risk is high. The Caribbean and Sub-Saharan Africa has the highest percentage of persons infected throughout the world. And so us in the Caribbean, us in the Virgin Islands, we are at a high risk, whether we want to accept it or not. So if you test and you test positive, you can get the treatment you need, prevent AIDS, prevent death, and prevent transmission to other persons.
There are 29 persons receiving HIV care and treatment in the Virgin Islands. Noeline Levens-Clark says, unlike other Caribbean countries, once persons test HIV positive in the BVI, they are placed on care and treatment. She emphasized that persons living with HIV must remain on treatment in order to avoid developing AIDS.
When you're on treatment, it lessens the possibility of AIDS. No one has to get AIDS anymore, much less die from it. It also reduces the possibility of transmitting the infection. If your viral load goes by treatment below 75-50 copies, you can have protected sex with a condom, and if it bursts, you still are unable to transfer the disease because you're on treatment, you're on effective treatment. And so we're encouraging persons who may have lapsed and decided they're not interested in treatment anymore to come back to us, see a doctor, get your labs done, let's see where you're at, because you will be feeling fine for a while, believe me, and we may give you a few years, but sooner or later AIDS will catch up with you. No ands, ifs, nor buts, if you don't get treatment.
There are 35 million persons living with HIV worldwide. Across the Caribbean, there are 1,250,000 reported cases of HIV.